Hi, our group is Ashley Harker, Katie Taylor, and Tiffany Speakman, and we're talking about advocacy organizations within the healthcare industry. I'm Katie, and I'm gonna take the first three questions, which are defining advocacy and advocacy organizations, and defining professional organizations, and then what are the differences between the two. So advocacy, and we talk about sometimes on like a spiritual basis, is someone who speaks for someone else. So sometimes we refer to like the Savior as our advocate with the Father. So in like common terms, advocacy is just like that, like speaking for someone else on behalf of someone that can't speak for themselves. So when it comes to advocacy in healthcare, it will be organizations that speak on behalf of certain patients or physicians, or they represent other groups of people in policy. So, as an advocacy organization, they try to influence public policy, and they don't necessarily have candidates up for political office, but they try to influence legislators, representatives, or senators that are already making policy. And they support certain policies or they oppose certain policies, depending on the people that they advocate for, the groups that they advocate for. And then professional organizations are usually nonprofit and they represent a certain group of people, maybe like physicians or nurses, and they focus on their professional careers and maybe helping them advance professionally. So they might offer seminars or workshops to help nurses or physicians, and there's usually an annual fee, but they just work to help those people advance in their careers and help them to yeah, just advance as far as they can in their careers. Go next. Thank you. So, like I mentioned, advocacy organizations, they provide services usually through lobbyists. So, lobbyists will represent certain organizations. So, for example, right now I'm doing my internship at the Utah State Capitol during the legislative session. And the other day I met a lobbyist who worked for Select Health, which is an insurance company in Utah. And so Select Health is an insurance company and they hired a lobbyist or someone to represent them in like the legislative session. And they'll go and they'll talk to, like I said, representatives or senators about policies that they agree with that would support Select Health or policies that maybe Select Health wouldn't agree with. Or sometimes they may be asking for like certain amounts of money and to help their program and support their program, like through state funds and things like that. And then, just like I said, professional organizations exist to enhance like the credentials and careers of their members. So they may offer programs for nurses to get certifications that help them to stand out in their careers so that they can have the best opportunities possible. That's it for me.
All right. So I'm Ashley Harker, and I research the principal advocacy organizations and the principal professional organizations that serve the healthcare industry, and then also what kind of service they provide for their members. The first one that I found was American Hospital Association. It's the national organization that represents and serves all types of hospitals, healthcare networks, and their patients and communities. It was founded in 1898. It provides education for healthcare leaders and is a great source of information on healthcare issues and trends. Some of the key issues that it advocates for are Medicaid and Medicare, um, the health information technology, medical education, and quality and patient safety. And then another one was the Federation of American Hospitals, which was founded in 1966. It is the national representative of more than 1,000 investor-owned or managed community hospitals and health systems throughout the United States. Its members are advocates of a market-based healthcare system, which benefits consumers by providing the high-quality, patient safety, and value of care through competition and innovation. Some of their key issues are similar to the last one, but it's health information technology, Medicare and Medicaid quality and patient safety, um, rural hospitals, hospital alignment, hospital preparedness, and veterans care. And then also there's the America's Health Insurance Plans. It advocates for public policies that expand access to affordable healthcare coverage to all Americans. Um, they also advocate for Medicare and Medicaid and high cost drugs, a delivery system and payment healthcare tax, and provider networks. Some of the reasons for joining America's Health Insurance Plans was it has a strong program that represents industry's interests before Congress and with federal administrative and regulatory bodies. Um, it advocates in all 50 state capitals and has up-to-minute tracking of the state legislation and promotion. And then medical affairs experts that are improving relationships with healthcare providers and advancing the quality agenda. And then some of the professional organizations that I found was the American College of Healthcare Executives, and that one's the leading professional organization for healthcare executives. It was founded in 1913 and is headquartered in Chicago, Illinois.
Ashley, I'm
It's
sorry. Will you
organized.
turn your microphone up just a little bit?
Yeah.
Okay. I don't know where it is on your screen now. Very top, maybe? Presentation mode makes it hard. I'm sorry. Click on the sound one. Right to the left, right? No. To the right, one more. The fourth one, right in the middle. That one.
I'll try to speak louder. Does that help?
There you go. Yes. Perfect.
Okay.
Wonderful. I think we
So
adjusted it down.
also,
You're okay. Go ahead.
there's the Healthcare Financial Management Association, and it's the leading membership organization for healthcare financial management executives and leaders. It helps healthcare finance professionals meet the challenges of the modern healthcare environment. Um, they provide education, analysis, and guidance. They build and support coalitions with other healthcare associations to ensure accurate representation of the healthcare finance profession. And they educate a broad spectrum of key industry decision makers on the intricacies and realities of maintaining fiscally healthy healthcare organizations. And they work with a broad cross section of stakeholders to improve the healthcare industry by identifying and bridging gaps in knowledge, best practices, and standards. Um, this one was Tiffany's part.
Okay.
I guess I'll just go ahead and read through it.
Yeah, that will be perfect.
So she was going to identify the organizations that have both advocacy and professional purpose, and can they have both? And when and how can you join these types of organizations? So she wrote, organizations that have both an advocacy and a professional function or purpose include health professions that have a professional practice that includes scientific knowledge or interpersonal skills. Advocacy relates to influencing institutional, community, national, and international policies. Whether you're a nurse, pharmacist, physician, dentist, physiotherapist, manager, or any other health professional, you can be professional as well as have a function or purpose. You can use your profession to care about others and to help and influence others to be healthy and take care of themselves. There are advocacy groups known as pressure groups, lobby groups, campaign groups, interest groups, or special interest groups. In order to join one of these groups, you need to influence public policy or public opinion. To join each of these organizations, you have to develop important social, political institutions, moral health, or commercial position. This is just our works cited page.
All right, thank you very much.